This is Marsha again. Before I post the new video for tomorrow on how my treatment went, I want to explain to you how it works. The theory is that my jugular veins are twisted and that they are having problems draining my brain. So the blood that is trying to drain out of my brain refluxes and goes back into my brain, and that is one of the reasons why there's damage on my brain and my spinal cord, the immune system. That includes iron deposits, and that blood is crossing the brain barrier and going back into the brain. The immune system responds by sending cells, I guess, into my body to destroy whatever's not supposed to be in there. That's very basic. So the angioplasty consists of sending in a tube of some sort into my groin area, up into my chest, and up into the jugular vein. From there, they're going to do some tests to see how the blood flow is going. And if that blood flow seems like it's constricted in any kind of way, or if they see any type of tubing that is twisted or not where it's supposed to be, from what I understand, they'll be sending in a balloon up the angioplasty into the jugular vein, inflating it, and then removing it so that there'll be a natural, easier blood flow from the brain down into the heart. And the theory is one of the reasons why I'm so tired all the time is because my body is not getting enough oxygen. My heart is not getting enough oxygen, if I'm not mistaken. And that's one of the reasons why I'm so tired all the time. So I'm going to post a video, if you'd like to follow me on my blog here on YouTube, as to how the procedure is done and what the results are when it's actually done. It won't be my video, but it'll be an example. So tomorrow's the time. I hope to see you with some good news. Till then, take care. Hi, my name is Marsha, and I'm here to tell you a little bit about my MS and the fact that I'm going to be having a CPSEI procedure tomorrow morning at 12 p.m. I was diagnosed with MS about 14 years ago, and I have what is considered severe MS. My MS is leaving primary, relapsing, remitting, and trying to move into the secondary phase of MS. I've had many different types of symptoms. I've had times where I wasn't able to walk, where I've had trouble seeing, where I've had problems with my vocal cords and wasn't able to talk clearly. I have severe, can't even think about it now, thinking problems, cognitive problems. I also have problems with heat. I've had palsy in the face. I've been paralyzed almost out of my body. I've tried all of the drugs pretty much. I'm currently on Copaxone. That's my last straw pretty much as far as the medicines are concerned. I haven't tried Tysabri only because my doctor didn't feel comfortable with me getting on that drug. I have tried these things. I've tried becoming a vegetarian. I've tried becoming a vegan. So tomorrow's a good day for me. It's going to be an exciting day because I get to try out the CPSEI. I've already been tested. I was tested on this Monday to see if there was any problems with my jugulars. That's the two veins here on the side of my neck. And apparently I'm having problems, especially with the right jugular. Probably explains the reason why I am weak on the right side. So I am going tomorrow for an angioplasty on Friday. So I was tested on Monday, having surgery on Friday, and I'm excited because I want to be able to ride a bike again. I want to be able to wear high heels again. I want to be able to walk straight again. I want to be able to remember things again. I want to be able to go back to school. So there's a lot of anticipation with this test that I'm about to take. I'm making this video today to show you what my symptoms are right now. I do have some palsy left over in my face, or nerve damage in my face. I have a problem with my eye. I have a problem with the symmetry of my face. I haven't felt the palms of my hands in about 8 years now. I haven't felt the sole of my feet in about 8 years. I have the horrible girdle effect that so many of us have every single day. It's a lot of pain every day. My legs are always cold, always numb, and I just have no balance whatsoever, not to mention no memory of short-term memory. So today I'm going to share my symptoms with you, and then hopefully after the procedure is done I should feel almost brand new and be able to walk straight. That's the goal. So I'm going to stop this now, and I'm going to give you a little look at how I walk, and hopefully when I come home tomorrow I'll have a new walk. Thanks. So we're out here now, here in sunny Florida. It's bright out here, and I'm going to show you how I walk. I'm going to walk away, and then I'm going to walk back. I'm thinking that the symptoms that I'm showing when I walk outside is I have no balance. I walk with a limp. Sometimes I use a cane. I think my physical therapist did tell me that she saw my feet turning inward, which I hope are not going to be. I'm not going to look. I'm not going to force it or anything like that. And I'm going to also give you a close-up of my face. And I'm hoping that in the near future, all the nerve damage that's been done on the right side of my face will resolve itself. I'm hoping that the myelin will regenerate. That's the sheet that goes around the nerve ending. It will regenerate, even though doctors say that it can't regenerate, and that my face will go back straight the way it was before. I'm going to walk away now, and I'm going to walk back. So today's a good day. Most days I drag my feet, both feet, and you can hear me coming a mile away because I drag them so heavy. My legs are like bricks. I'm going to try to stand on one foot here. This is something I don't usually do. Here to do it. I'm so cheap. So I can't stand on my one foot for a long amount of time. That's my right side. And the left side, I think I'm a little bit not better at all. I have very poor balance, as you can see. I have a lesion on the back of my brain, the cerebellum, that affects my balance. I've also lost of my hearing on the right side because of the nerve damage there. And I have a slew of other problems too, and I will get into more detail about those symptoms as we progress on with time and seeing how the treatment helps me. So I hope this video helps you, and stay in touch because there's going to be a lot more things to come. Thank you.